Welcome, everyone. My name is Erin Kalkis, and I head up insurance sales for CBIA. This is a brief webinar just to kind of make you aware and talk to you about a level-funded health plan option for CBIA member companies. So welcome. And just as a reminder, this is being recorded, and you will get a copy of it in the next couple of days or so. If you do have questions, please put them into the Q&A section on your screen. Those will be collected and we'll respond to you via email after the presentation. Also, if you put a question in the chat function, it won't be collected. So I really want to make sure that any questions that you have, you can throw into that Q&A section and we will respond to you. And again, this is being recorded, so you'll get a copy. So away we go. Okay, I mean, I don't have to tell you guys, what your challenges are when it comes to employee benefits, specifically here in Connecticut. We know it's one of your biggest expenses. We know that, the market seems to be shrinking, carriers are leaving, premiums keep going up, benefits keep shrinking. Again, nothing new to you, as I know you're struggling with all of this as well. Um, and because the fully insured market is tending to shrink a little bit, with carrier offerings and with, just the environment in which we're in, most employers are at least considering a level funded plan if they're not already in one. And so I wanted to talk to you about, really what is level funding. So just a few minutes, and I apologize for those of you who may already know all this, but I want to make sure that we have a good sort of level set of what level funding is. If you look at the three kinds of plans that are in the market today, you've got fully insured on one end of the spectrum, which gives you predictability in terms of your monthly premium payments, right? And you are paying that amount every single month, regardless of if you have high claims or low claims within your company. The other side of that is self-funded, where you are paying yourself, the business is paying for the actual claims as they're incurred every single month. And that's really hard to predict because one month, you could have $1,000 worth of claims from your employees, doctor's office visits, prescription drugs. And then the next month, something chaotic, crazy, catastrophic happens. And now that next month, instead of $1,000 in claims, you have $10,000 in claims to pay. And it's very hard to keep up with that sort of ebb and flow of claim activity. Very hard to budget for. But level funded actually is kind of the hybrid. It combines both the predictability of that premium payment every single month, but potential savings at the end, because basically you are in a self-funded plan, except that instead of paying those claims as they're incurred on a monthly basis, we're breaking that out over a 12-month period, right? So instead of having $1,000 in claims one month and then $10,000 the next, and on we go, we're still paying for the claims out of a claim fund, but that payment is predictable every single month. So it makes it easier for you to budget. This is a nice sort of visual of how it works, right? So you have a claims fund to your left. That money in there pays for all of your member medical claims. Stop loss insurance is there at the top to really protect against any large claims. So those catastrophic things I was talking about. And then the admin fee is baked in as well to help with plan management and reporting and things like that. So when you add all of those pieces together, you get one fixed monthly cost. What's important about the claims fund is that Essentially, we're predicting what we expect you to pay in claims throughout the year. And so if your claims actually come under that expected amount, there's a surplus at the end, and that surplus is your money, right? You've paid, essentially overpaid for your experience over the past year. CBIA is doing something different with our level funding product. CBIA will give you back 100% of that surplus. The other carriers in the market will only give you back a percentage. Some are offering you 50% of your claims fund back. Some are offering you as little as 40% of your money back. CBIA believes that you have overpaid. We want to have you have your money back. And so we will give 100% back to you at the end of the year. But who are we, right? So many of you know CBIA for our advocacy and our other benefits, but may not have been involved in any of our previous health benefits options that we've had before. We've been doing insurance for CBIA member companies for, well, over 25 years, close to 30. We were basically, running the country's first private health exchange before that was even really a cool thing. And we were doing that back in the 90s. So we have a long history of doing what we can, of looking at the market and finding best solutions for our CBIA member companies. This product that we're offering, this new level funded product, is focused on small and mid-sized businesses of really 10 plus enrolled employees, but there is really no cap. I mean, our target market is somewhere probably between, I would say 40 and maybe 120 employees enrolled. Um, Once we get below 10 or really above, say, 150, the level funding product isn't necessarily the greatest match. I mean, it certainly can be, but in terms of the target groups that we're looking for, the target groups that we think we can help the most, it's really in that range. And I'd also like to remind you that we are, working in the CBIA building. You may not know anything about Health Connections or the fact that we've offered these benefits in the past, but we are local. We support Connecticut businesses. We support local service, and our service and our standards are legendary. Why employers choose our option. So, if you look across this chart here, you'll see us, our CBIA level funded plan, compared to more traditional level funded carrier plans and traditional fully insured plans. Again, we're going to return 100% of any available surplus. The other carriers in the market aren't doing that. In addition to surplus, there is something called a pharmacy or RX rebate. So for high cost brand name drugs and specialty drugs, the manufacturers actually rebate carriers for paying for those drugs to their members. Um, the carriers typically keep those rebates. We are passing those rebates back on to you into your claim fund to help bolster that surplus amount at the end of the year. We also offer full compliance support. So things like 1095s, things like CDRX, things like PCORI fees. You are fully supported by the administration team here at CBIA. We can't necessarily say that about others in the market. We offer free COBRA administration, and we also offer a whole wealth of ancillary benefits from dental and vision to critical illness, accident, to health, to life and disability, short term, long term. We basically have a full employee benefits package that we can wrap around the medical for you. Easy administration as it all appears on one bill. It's all itemized, so you know exactly which one of your members, your employees have which benefits and what level. That's all on one bill. And again, with really superb localized billing support. When we talk about built-in savings potential, this chart really exemplifies how much you can be getting back in a refund. It depends on, of course, how much is happening into your claims fund, right? So if you have lower claims mean you've overpaid more, it gives you a greater chance of a surplus. Moderate claims, look, that's the one thing I know about this market is that every employer group has something. Someone in your on your plan has, you know, a high cost drug or a diagnosis that they're monitoring or they may be in maintenance. But every group has something going on. And so a lot of our groups that we write today fall in between sort of this low and moderate claim mark. You can see the refund potential there, right? Lower claims, meaning a higher refund of $18,000. Wouldn't you like to get all of that back? Today, we're one of the only carriers that are doing that for you. So here's sort of the details of the plan. We offer 6 plan designs, so we try to keep things very simple. The plan designs that we offer in our portfolio are some of the most popular plans that we've seen in the market. We have some HSA qualified plans and some traditional sort of deductible copay plans, so that you have a nice spectrum of offerings to your employees. You can offer as many or as few of these plans as you'd like. Many of our employers will offer around 3 or 4, just to make sure that they have a plan that they're benchmarking their contributions off of, and perhaps 1 or 2 buy-up plans or 1 or 2 buy-down plans, depending on your contribution strategy. Our prescription formulary is a 4-tier. MAC A pricing just simply means it's generic mandatory where available. If you've participated in Health Connections ever before, you may have remembered that we also at one time required a life insurance policy to be bought with the medical. That no longer is a thing. So if you want to join our level funded medical program, you can just buy that standalone. You don't have to have life insurance. You don't have to have any of the other ancillary or non-medical benefits if you don't want to, or maybe you're not offering them quite yet. Again, we are trying to access information for you to understand your monthly costs and create a stable program. So we have a lot of cost containment features within the plan designs. You'll see on the right-hand side, $0 copay for virtual care services. That's really more than just a late night call to a teledoc because, you know, you have a screaming kid with an ear infection, right? This is, I mean, it can be that, certainly that's available, but this is more in an attempt to really combat the lack of access that we're finding in trying to get PCPs and behavioral health providers. I mean, I can speak from experience. My PCP retired and, you know, moved away, and I had been in the practice for years, but I wasn't able to get in to see another PCP for over a year, right? So in that situation, moving towards a virtual care situation where I'm seeing a provider, it's just on screen rather than in person. But that provider, I build a relationship with them. They can order me lab work. They can send me devices to monitor my blood pressure, my cholesterol, things like that. There are a lot of tools that they have to help make sure that you're healthy and well, just like the PCP that you may go to in an actual brick and mortar center. So it's a great option, especially for your younger employees who tend to be way more technically savvy and they would rather have that experience at a time that's convenient to them rather than taking time off of work or out of their day to go to sit in a waiting room and talk to a PCP. So that is a zero cost option. What that means is they're not paying anything more out of their pocket, but also that means it's a lower claim hit to your claim fund. So you'll see throughout this presentation, we're constantly trying to mitigate your claims so that at the end of the year, you have a more stable renewal and you have more money in your surplus to get back. Another real advantage of our program is you'll again see on the right-hand side, zero cost advanced imaging options. So we have a concierge member service team as part of this program. And simply, if when one of your employees is prescribed a PET scan or CAT scan or MRI, if they simply make a phone call to their concierge member services team, that team will connect them to a independent, which means not hospital owned facility. Think of like Radiology Associates or Jefferson Radiology. It's those type of independent facilities that your employees will get access to at a really reduced cost to your claim fund. To the member, to the employee, it's free. There's no cost to that. All they have to do is make a phone call. Their operator on the other end will connect them to the facility, actually keep them on the line while they make the appointment and arrange the payment so that all your employee has to do is simply show up. Really takes a lot of the headache out of it. And again, we've seen over the past year about a 60% savings in hits to the claim fund versus just walking into Hartford Hospital or to Yale for those types of services. So again, talking about our concierge member services team, it is one call. So one number to call for your employees to get access to all of the vendors that we have built around the Cigna network. So basically what we have done with CBIA Health Connections and this product is we took a step back. We wanted to make sure that we were providing to our member companies the best kind of experience that we can. And insurance, I mean, I know you've seen it, right? We go through these open enrollment meetings and your broker or their account manager, or maybe even you are explaining the benefits and you can kind of see everyone glaze over. And especially when you ask, do you have any questions? There aren't any to be to be answered. They just pick up their paperwork and leave. This concierge member services team is through a company called Valence Health. It's a division called NavCare. And this number is on the back of their ID cards. It's on the back of all the marketing materials that we can send out, all the educational pieces that we have for you and your employees. That is their team. And they actually speak human. They listen to the caller. They try to understand the concerns. They try to understand the questions, and they really do help. The feedback that we have gotten from NavCare has been excellent. They're kind, they listen, they understand, they help direct. It's a really different experience than maybe something that you and your employees have been used to in the past. So this is probably my most favorite topic to talk about. Well, insurance is my most favorite thing to talk about, and part of insurance is the pharmacy benefits, right? So we use a company by the name of Ventegra. They are a company out of California. And even though you're not in the insurance business, I bet you can understand that pharmacy benefits are the most costly sort of thing that happens to your claim fund, right? You see these drugs advertised every single night, watching Jeopardy. If you're a Jeopardy and Wheel of Fortune watcher like I am, it's all of those high cost drugs that are really doing wonderful things for people, but they cost a lot of money. And so, what this company does, Ventegra, is that they're not for profit, they're independent, they're transparent, and they work extremely hard with members to help find them not only the best quality of prescription that they can, but also at the best cost. So it could be that a really expensive drug that an employee was just prescribed to take is only really expensive because it mashes two different ingredients into one capsule. Whereas a lower cost alternative to that might be two small tablets at the same dosage, same thing. It's really just convenience of one capsule over two tablets. Our team at Ventegra will help your employees save money. They'll save money in trying to offer the most effective drugs at the best cost. They'll also help in trying to find your employees discount coupons, or even going as far as to work with the manufacturer of the drug to offer that drug to them at a zero cost. That's the kind of outreach, that's the kind of involvement that the team has with your employees. We've seen over the past year tens of thousands of dollars saved by offering these coupons to our member companies' employees. They also price the plan differently, and without getting into a whole lot of insurances, basically they have a completely different model in how they purchase the drugs from the manufacturers and from the pharmacies. And that different model, just in of itself, saves over 25% in claim hits to your plan. There was a study that was done in 2003, I believe, where a company basically surveyed pharmacy benefits managers and asked them to take an average of the drugs that were prescribed in their program over the last year. And what turned out to be they found that the cost to the plan on average, so the average cost per member per month, not even per employee per month, but per member. So that means employees and dependents. The average cost of a claim hit for prescriptions per member per month was ranging about $143. Ventegra took that same study and bounced, just out of curiosity, they wanted to see how they compared. They bounced that study off of their same claims over that same period with the same drugs that were originally studied. And they were able to bring the price down to around 83. It was like 83.46. So $83 a month as opposed to 140, whatever, just in how they change their model is a huge savings for you. They really focus on the 2% of the members that drive 50% of the claims. As I was mentioning before, pharmacy spend is really, really high, and the drugs that are coming out are very expensive. But not everybody is on them, right? Only about 2% of people taking these high cost drugs represent 50% of the claims. So if we can really get to those 2% of people, give them low cost alternatives, find them ways to save for manufacturing discounts and coupons, we can really, really make an impact here. Another nice feature of our program is the ability to do some shopping. So I know I'm oversimplifying things here, but my favorite example is basically shopping in the cracker aisle, right? So you go to Big Y or Stop and Shop or ShopRite or wherever you shop, and you stand in the cracker aisle for probably 3 to 4 minutes to try to decide, gosh, what's the best cracker? What is the most expensive? What's the one that my family likes? What's the one that's healthiest? What's the one that's going to go with my brie on Sunday for my charcuterie board? And that purchase decision takes a little bit. And yet it seems that when we are faced with a similar decision about our healthcare, we sort of just follow blindly and ask around, hey, where did your grandmother get her knee replaced? Oh, she went to Yale. Oh, okay, I guess I'll go to Yale too. Not a great option when you want to try to save money. So our program has what's called Healthcare Blue Book, and you'll see an image of it here on your screen. Basically, you type in a zip code and you type in the kind of procedure that you need to have done. This is available to every member of our program. You'll see on the screen that a fair price for a total knee replacement in whatever area of, I guess, Tennessee we're looking at is about $35,000. Okay. You'll see also on the screen that it is marked by green, yellow, and red for both quality and cost. And what we want to see is green, green. Good quality, low cost. That's the first option here on the top of your screen. The bottom option is red, red, which means not so great quality and really high cost. And you would be amazed at knowing that not every hospital has the best specialty, right? They build big, wings, and they have commercials and they tout great things, but they may not be superb in all areas. It's not to say they're bad. It just might be that they cost a little more than the hospital or the facility, 20 minutes away. So this provides an opportunity for you and for your employees to start to be conscious consumers, not just consumers, but conscious consumers of your healthcare. And only by doing that and understanding that you have options will continue to lower those costs and again, those hits into your claim fund. So we talked about the virtual care. I just wanted to mention here that this isn't kind of a fly-by-night vendor, that they have a 92% patient satisfaction score. The company is called Recuro, and they're actually one of US News and World Report's best digital companies for healthcare in 2024. I mentioned our full suite of benefits earlier, and so I just wanted to talk a little bit about that because CBIA Health Connections is really an umbrella. It's a whole portfolio of options, medical just being one piece. But wouldn't it be lovely for you, instead of having different bills and different people to pay, you could wrap your medical and all of your other benefits that you offer, dental, vision, life, disability, critical illness, accident, you name it, except for pet insurance, we probably have it. If you could wrap that around and have that all on one bill, I think you'd find the administration to be quite easy. You already know about the benefits of CBIA because you're CBIA members, right? But I wanted to tell you that you are critically important to our organization, not only on the legislative side for advocacy, not only for our products and services, but for you, you're more than just an insurance client. You're really a part of us. And we have spent the last 30 years designing programs and plans and benefits that work for you. We want you to have an excellent experience. We need you to have a positive claim fund at the end of the year so that you can invest back into your business or your people or in that, copy machine that you need. You're very important to us. But is the plan right for you? So I've sort of gone through it. It's a stable cost every single month with the potential upside of a really nice surplus at the end of the year. We have options for groups that are, starting at 10 enrolled lives, upwards of 300. We're hoping that this creates a predictable and stable environment so that you don't have to shop for your benefits every year, that your premium increases, your renewal are great. They're flatter than they are trending upwards. And this all works if you're a reasonably moderately healthy group. So the call to action here is first, if you have any questions about anything that I said, I want to give you my email address. So please grab a piece of paper and a pen. I know, pen and paper, I'm so old. But anyway, my email address, please feel free to email me directly at Erin, ERIN .Kalkus, KALKUS as in Sam, at CBIA.com. I head up insurance sales here for CBIA. I've been here for 25 years. I've kind of seen how everything goes, and I understand how difficult it is for people who aren't in insurance to understand. It's a completely different language. I couldn't do your job. I couldn't be the expert that you are in your field. And so please reach out to us or your insurance agent. We only sell our products through independent insurance agents because we firmly believe that they are advisors, that their consultative approach can help you understand where you are today, where your company needs to go, what kind of benefits you need to offer now and in the future to really attract and retain that critical workforce that's so important here in Connecticut. Your insurance agent is the key person to talk to about this product. If you are unsure about your agent or if you're potentially looking for another agent, again, I've been here long enough that I know a lot of them. I know, if you need some help with that, please reach out, send me an email. You can also find my information out on our website. I want to thank you so much for taking the time out of your day to understand a little bit more about what CBIA can do for you when it comes to your employee benefits. I hope you reach out. I hope you think about some of the options that are out there and some of the ways that we're handling things like surplus and rebates and customer service. And I hope you think of us differently because we think of you often. Thank you so much for your time. Have a great afternoon.